Alright, now we've finished that consult, let's have a look at dictate. So we're in Lyrebird here. Now let's click up on dictate and I'll show what this does. So direct dictate is similar to a generic voice to text transcription service. It's going to transfer your voice into text almost directly. So every word you say is going to be turned into text. We're not going to add much formatting. We're not going to add much structure to the letter. We're not going to change what you say. It's just voice to text. Smart dictate adds a little bit of AI into Lyrebird's dictation. So essentially, if you think about dictation like this, we've got 3 different modes of using Lyrebird. This first is direct dictate, where your dictation length is similar. So you're still doing 4 or 5 minutes of dictation. The benefit of using direct dictate over another dictation service is your result is going to come to you straight away, rather than having to wait for someone to type it up or wait for a service to transcribe and send it back to you. So that's the benefit of direct dictate. The benefit of smart dictate is it's supposed to reduce the length of your dictation, and it's supposed to alleviate some mental burden of doing a direct normal dictation, because you don't need to speak to it in a verbose or verbatim way. You can just say something like, I need you to write me a letter to the referring clinician and CC the school for David, who came in today. He's 15 years old, presenting with type 1 diabetes symptoms. He has a sore on his elbow that hasn't been getting better for the past 3 months. He's been going to the bathroom 4 or 5 times each night. He's been drinking 2 to 3 bottles of water every day, and on examination his chest was fine, his lungs were clear. We did a urine test and his blood sugar level was 14 millimoles. He had ketones of 1.4 as well. We haven't done a blood test. I've referred him directly to the emergency department for some more tests to be done to confirm a diagnosis of diabetes. But I just wanted to let the school know that David won't be in class for the next couple of days or weeks. I hope you understand. So yeah, just send this to the school and the GP. So you can see that I didn't speak like I would in a normal dictation. I didn't say, "Dear doctor, my name is David. I've seen David today. He's a 15-year-old male." I just gave Lyrebird all of the information, and Lyrebird's taken it, structured it, and put it into a letter format. So have a read of that. Let me know what you think. I think that looks pretty good, and it's alleviated some of that burden of doing that dictation. I can go back on what I wanted to say and say, hang on, don't say that anymore, change it to this, and things like that. I can then copy that and paste it to wherever I need it to go. I will give you an example of direct dictate as well. So, dear Dr. Smith, thank you for referring David. He's a 15-year-old male who presented with type 1 diabetes symptoms. He's been having these symptoms for 2 to 3 months, drinking lots of water, urinating 4 to 5 times per night. Full stop. I've referred him to the emergency department to complete further testing. Full stop. He will not be at school. CC patient's school. So we can stop that, and it's going to generate that dictation for me. Still pretty good, and it's transcribed exactly what I said, added a little bit of formatting, but you understand the differences there. Now, that's dictate in Lyrebird, and you can dictate after you've finished a consultation. So let's open up this one that I did before in the last video, and we can see here that we've got the SOAP note, we've got our letters over here, but maybe I don't like the letters, or I want to do something that's different. So I can use dictate. I can do a direct dictation or a smart dictation right here, rather than having to go into dictate and use. I can do a dictation here and say the dictation whilst reading these SOAP notes on the left hand side, or the letters on the right, to remind me of what I needed to say. And that's it for dictate.